Welcome to Dolan Days. Thank you for being here. Thank you for stopping by. If you absolutely love what we do on this channel, please like, share, and subscribe. I am so grateful for your support. Welcome. I've got a spectacular presentation for you today. As always, we are back in the doll hospital. And guys, I have been busy making all kinds of awesome crafts. Look at this lovely little med cart I've got here. You know, very similar to the ones we use in the hospital. And there goes our nursey. She's going to be our wound care nurse today. Her name is Alana, and she's a beautiful soul that really loves her patients, puts her heart in the center of what she does. So today we're celebrating Miss Alana and what she does in healthcare. So guys, sit back, relax, get your pens out, take notes. I've got some awesomeness in today's video. I'm going to be showing you how we do wound care in the doll's house, or should I say the doll hospital. Stay tuned, it's gonna be fun. So standard nursing procedure in healthcare is prior to starting anything, you want to, provide privacy, of course, wash your hands, introduce yourself to the patient, explain what you're there to do. So this is just a part of the process. Miss Alana has already washed her hands, introduced herself, verified the patient, and is now explaining that she's making preparations to complete her wound care. And she's going to go get the supplies together, get all of that ready, and I'll show you guys. Guys, oh my goodness, I had so much fun doing this. Everything in doll world is just super cute, isn't it? Like, there's just something magical about taking anything life-size and shrinking it into the doll space. It's just such an awesome thing to do. Guys, look at this super cute dressing supply display I've got going on here. I made every single item there by hand, okay? Of course, there are little printouts, but I tried my best to make, just to get as close to realism as I possibly could. Look at that, how cute. So here we go. And of course, if we're doing wound care, I want to show you guys how to make wounds. So that's what we're doing here. Nothing too fancy. I just want to show you how you could use your imagination and do something spectacular. So I've got some hot glue. I've just got some random paper from package in here. You could really use anything as your base, and no particular shape or form, just a dab of glue there and just let it go where it needs to. Actually, the more imperfect it is, the better, the more true it will be to realism. So what I'm doing is I'm trying to shape like a decubitus ulcer. I'm also going to make a stoma. That's what I'm doing right here for colostomy. No, Doug. Guys, I know this might sound gross, but listen, I'm trying to make it fun. All right. So this is for another video, but I'm just showing you guys how to make, a variation of wounds and what you could do with some hot glue and some paper and a little bit of paint. So yeah, I'm just shaping that nicely. And this is just a piece of rubber. Like I said, guys, I keep a little drawer of scrapped items, and you just never know how these will come in handy when you're doing crafts in the dollhouse. So I hold on to these little thingies. And what I'm going to be doing with this piece of rubber is just kind of making something similar to what would look like a superficial skin irritation, like superficially excoriation, or should I say superficially excoriated area of the skin. I'll paint it and I'll show you what I do. It's also quite bendable and flexible too. So as always, guys, I tell you whenever you're painting, and this is just watercolors that I'm using on the hot glue, the dried hot glue here. So you start off with the absolute lightest colors first. And when you look at wounds, you're thinking flesh tones and stuff, right? So you start off with the lightest colors and you just go from there. So you saw what I did, and now I'm just painting the rubber just to kind of make it look a little bit like a superficial skin excoriation there. Just some redness, I should say, or discoloration to the skin. But very true to realism. And you just build, guys. Use your imagination. When it comes to wound care, some wounds are healthy, and you could look up what healthy wound tissue looks like, and just kind of follow that. There's also wounds that may be infected, and yes, it may look a little gross, but like I said, just use your imagination and try to be as true to realism as possible. There are different types of wounds, and wounds may vary in complexity and may require different levels of treatment. So, not to take the fun out of it, remember, everything in doll world is supposed to be fun, okay? Yes, we're gonna add some realism here, but it's fun. All right. So yeah, just do a little research, type in wound care or wounds on the internet. Just do a brief little read about it. And hey, you could create something wonderful for your dolls, if you want to set up a hospital scene. So nice. And this is our young lady. This is the patient here, who has a decubitus ulcer. That nurse Ilana is going to be helping to do the dressing changes for today. So here we go. Nurse Ilana is letting the patient know she's going to get ready, prepare all the equipment and everything she's going to need in order to do a safe and as comfortable as possible dressing change. Now, the patient may have asked for some pain medicine, and yes, I think Nurse Ilana is well prepared for that as well. Medicate the patient with pain medication prior to the procedure. And of course, here she's got all of her stuff lined up to get the dressing change done. Take a look at this realism and look at the smile. Look at the smile on Ilana's face. I am loving it, guys. Don't you love the realism here? Look at this room. Don't you just want to go there and be a part of all of this? Yeah, I'm there. I'm there for real. This is awesome sauce. Love it. So segue for a little bit, guys. As a healthcare worker, I work ridiculously long hours, but my job is an absolute joy and a blessing. I love it, but I haven't been able to post videos as much as I would love to. So guys, I cannot tell you just how grateful I am that you guys are here sticking in this with me. You show up and you show out. I love your comments. I love that you're being inspired by my efforts. This is so super beautiful. I've just been working a lot, but I do take a few moments at the end of my work days, even if it's just for 5 minutes or 15 minutes in the studio, and I would just create, one item at a time, and that's what I've been doing in preparation for this video. So thank you. So now we are getting ready to complete this dressing change, and of course we've explained everything to the patient. We have washed our hands, donned our gloves. Now I'm positioning the patient, let her know, hey, you got to put your hands across your chest, give yourself a little bear hug, okay, so your arms are out the way prior to starting the procedure. And I've removed the sheets there to expose the area. There we go. She has a stage, I'm gonna say that's a stage 3 decubitus ulcer to her right lateral leg there, lateral aspect of the right leg on the lower extremity there. So we're gonna complete that dressing, and of course I'm just showing you all my little equipment here. I've got this abdominal pad that I made my goodness, I think I used dryer sheets and tissue and put that together. And of course, that's what's used in the healthcare setting, for dressings that have really heavy drainage. And I've got some gauze here, like a roll of gauze, which we'll use to wrap the extremity upon completion of the dressing. So here we've got this little cotton tip. Typically in the real world, we use this to kind of, estimate the depth of the wound, and we also use them as part of cleansing the wound as well. So yeah, now I'm just positioning the patient's leg appropriately. You want to elevate it as tolerated, as much as the patient tolerates. You do want to maintain safety and comfort here, and of course medical cleanliness as well. We don't want to get the wound infected, so all this is important, of course. Miss Ilana is the one that's doing all the dressing here, so I'm just facilitating, guys. I'm just the narrator. So yeah, just cleansing the area, and we apply our dressing. I'm thinking maybe some Silversorb gel or something, and then we cover that with a clean abdominal pad, which is gonna absorb some of that drainage from the wound. And now we're gonna wrap that extremity with the Kerlix gauze here to kind of secure everything in place. So that's what we're doing here. Isn't this so awesome, guys? Oh my goodness, this is just like we do in reality. This is so cute. Oh my goodness, guys, play therapy is everything, I promise you. There goes the completed dressing change. Our patient is comfortable now, and she is relieved. She is just so happy that the dressing's done. She tolerated the procedure very well. So now Nurse Alana has to document the patient's response and any findings, regarding the dressing change and everything. And she brought her a nice warm cover there. And I'm going to show you what I do here. This is just some material I got from Walmart, and I just fold it down nicely and neatly. I love this beautiful color of blue. Blue is actually my favorite color, so yeah. And fold that nice and neatly and get the patient all tucked in and comfortable. And look at that. Absolutely fantastic. If you enjoyed today's video, guys, like, share, and subscribe.
Man, I feel really sad about what's happening to her.
Yeah, it's sad. Smoking is really bad,
Yeah. Well, I'm hungry. You want to go get something to eat?
Yeah, that's a good idea. I've worked hard today. I'm kind of hungry.
Where you want to eat?
I don't know. Pizza?
Bruh.
Thank you for stopping by today. I'll see you next time on Dolan Days. Until next time, take good care of yourselves. Eat healthy. Stay happy. Bye-bye.